Hey everyone, Rachel Run180. Check out Fred in the back there, he's awesome. He's going to help me explain to you a couple of the more common running injuries that we see. Now, knee pain is the most common running injury, but it's absolutely crazy that indeed from our foot all the way through to our crown of our head can get affected with adverse running mechanics. So let me bring Fred over, and what I'd like to do is talk to you today about specifically knee pain and how running properly avoids knee pain, and how when we're running with a lower step rate that you're more likely to run into. There are 4 key running pains in the knee alone. So let's try and cover all of them today, and you can determine for yourself which category you belong to, and then indeed question whether or not you might want to change your technique so that you can avoid, A, treat, and then B, permanently avoid running into future knee problems. Just as a side note, everyone, some of you know I'm a sports physio. I've been a sports physio for 25 years, a run coach for 10 years. And when patients come to me and they have, let's call it jogger's knee, a typical running injury, what I do is I get them running properly. Even though they have pain, I get them running properly, and they'll say to me, well, my knee didn't hurt when I was running. It'd be like, yeah, because you weren't running in an adverse way that then puts mechanical tension where you don't want it. Okay, so bear with me one moment while I talk to Fred nicely and borrow his knee. Okay, so it's a good job I don't treat my patients like this. I am hoping that you can see this. Let's have a look at what's going on within the knee, and then we can have a look at the 4 key areas where you get knee pain, and then just talk to you about how to avoid them. Okay, so fantastically, I'll just give Fred a nudge here. What we've got is your lower leg bone is your tibia, and your upper leg bone is your femur, and then we've got this awesome bit of kit called your kneecap, your patella. And so that's the bony aspects of your knee. Your knee flexes and extends, and it also has a slight rotation element to it. That's natural. Okay, so then on this other model, and I wish I could pull that bit off, but all good. What I'm wanting to show you in here is some awesome bit of kit. These little blue discs are called your meniscus. Now, they are shock absorbers, and they are also designed to help cup the ball of the femur there into the socket, the top of the tibia. Okay, when you run with let's start with the adverse. When you run with a low step rate, you can get all 4 common running injuries. The 4 common running injuries: anterior knee pain, chondromalacia patella, moviegoer's knee. It's pain at the front of the knee. People say to me, it feels like it's just inside, just at the front of the knee, just behind the kneecap. So that's literally where you're aggravating the back of the kneecap. Okay, so that's one. The typical running injury is called jogger's knee, and it's pain on the outside of the knee from adverse overtension of a structure called the iliotibial band. So that's number 2. Number 3 is where we can get pain on the inside of the knee joint. Basically, it feels like a pinching feeling, a burny, pinchy. People have swelling just right there on the inside of the knee joint. And then the 4th one is just this vague, diffuse discomfort at the back of the knee. Okay, cool. So what's going on? I mean, so with that lower step rate, everyone, what I've said before in other videos that I've made is that when you have a low step rate, you are taking weight through your heel. Now, if I can just use Fred's other foot, and I'm hoping you can see this. In the heel, everyone, I mean, the foot is just this awesome structure, but let me come to this in a little bit. The foot is your heel bone, your calcaneum, then your talus, then your tibia. When you've got a low step rate, your weight bearing through that heel, there is 0 shock absorption through that entire system, all the way up to poor Fred's head, all the way at the top down there somewhere. Okay, what that's going to do in terms of affecting the knee joint is when you're putting your foot out, you're then getting direct compression through these soft tissue structures, your cartilage and your meniscus. In terms of what we call, let's go to number one that I mentioned earlier, anterior knee pain. So that front of knee pain is because when you land through the heel, the first aspect to contract are your quads. So muscles at the front of the limb. What they do, everyone, the quads are awesome. Let me not say too much about them, but what they all do is they encapsulate the patella and then join into the tibia.